Speak up? Okay. Grief fills the room up of my absent child. Grief lies in his bed, walks up and down with me, puts on his pretty looks, repeats his words, remembers me of all his gracious arts, stuffs out his vacant garments with his form. Then I have reason to be fond of grief. Sometimes it's the grief that keeps us close to our loved ones. You know, people are always telling us to move on, but to a certain part of moving on means letting go, and a certain part of letting go means forgetting. And you know, forgetting is why we are here tonight, so we do not forget. We do not forget what we've been through, what our people have been through. So that's why we are here. We are here to remember our loved ones, to not let them die in vain, to be forgotten. We, all of us, have been forced to say goodbye, but we do not want our loved ones to be forgotten. And we, all of us, have something to say. We are here tonight to remember the persons who have suffered from the disease of addiction and lost. We are here to speak loudly, and I do mean loudly, that something has to be done to demonstrate as Americans, we are Americans, that we care about a disease that has taken away too many lives, and that we are asking other Americans to help us in this fight to be heard. My son James Avatabili was intelligent, handsome as all could be. He had the greatest dimple you ever wanted to see. Athletic, and my baby boy. Born to me, he was the third baby boy born to me and my darling husband Louis. He was loved, had an extended family, and he was the face of addiction. Like all of us here. We are black, white, orange, and brown. We are tall, short, heavy, and thin. We are rich, poor, and everything in between. Looking back at the time, I didn't realize when I took my son to the emergency room at age 15 with a broken collarbone, or again later with torn ligaments, my son too was an athlete, that the pain pill that they had prescribed were a lot more than the average Tylenol with codeine. I thought I was being a good mom, following doctor's orders. Those early days were the beginning of the destruction of my sons. My son James was a tormented soul during his years of addiction. He went begging for help, and as you know, as well as I know, and where society tries to throw this to us, that yes, he had trouble with school, he had trouble with the law, he had trouble with the relationships, he had trouble with family and friends. He made many mistakes, and he hurt me and his family time and time again. But in the end, we loved him just the same. We too are the victims of addiction. When they say it's a family disease, believe it. One of the examples that I give tonight that's a little bit off of a personal is I felt so sad when Whitney Houston's daughter, Bobby Christina, passed away recently. It really resonated to me. And I thought how addiction took away her life and destroyed yet another family. She was gorgeous, talented, and had everything going for her. I would actually feel embarrassed for her during some of her interviews. You remember some of her interviews? And she was just so thin, and she just looked terrible, and she would be trying to convince us that she wasn't an addict. Just like we've all lived with our children and our loved ones when they try to tell us, no, and you know you're not talking to your child, but you're talking to the addict. I felt embarrassed for her as she would try to deny that she was an addict. The disease infiltrated her entire family, right down to her daughter, who recently passed away. They tried to blame her husband. Not that I'm a Bobby Brown fan, but nevertheless. They tried to blame her husband. they tried to blame the media and whatever else they tried to blame. But she had a terminal illness. And unfortunately, even with her millions of dollars, no amount of money could ever save her. So, some people would say, why save them? They did it to themselves. But I beg you to listen to me, to spread the word. Is that what we say to the person when he is told that he has a disease of cancer? Is that what we tell a person who has heart disease, diabetes? Can you imagine going to the doctor and being told you have a serious heart disease, but we'll treat you in only for 3 days, like our children were told? We give you 3 days of treatment. Insurance companies kicking your ass out. Can you imagine a loved one with heart disease being told that? Or maybe only a week of treatment, or 12 days at the most. That's what my children were told for their disease. We can't save every person with cancer, but we do fund for scientists to do extended research, treatment, for doctors and experts to be educated and trained in the field, in a society that believes in treating the cancer's patient. Because of this research and et cetera, we have and we do save many persons with cancer compared with 10, 20, 30 years ago. When my husband was diagnosed 3 years ago with glioblastoma multiforme, which is a terminal, fast-moving brain cancer, the same kind that Ted Kennedy had. It was terminal from day one. When they sat me and my sons in the room, they said, your husband will never live. There was no hope. But guess what? Hundreds of thousands of dollars were spent on him with surgery, radiation, chemotherapy, in the hopes that just maybe they would save him. Even though they knew they probably couldn't. It's like only 3% the last 5 years. Why, you might ask? Because there is value to his life. Because there is value to a cancer patient's life. Maybe he smokes cigarettes. Do we blame him? Maybe the person who's a severe diabetic eats too much sugar. Do we blame them? No, we help them. The medical field helps them. There's millions of dollars of research being put into cancer. And they learned from my husband, from treating my terminal husband, in hopes that they will be able to serve the next person and save the next person. This is what must happen with the disease of addiction. One of the issues happening with the disease of addiction in many of our loved ones is that we continue to fight a high level of stigma and discrimination. On June 5th, 1981, the United States Centers for Disease Control and Prevention published a morbidity and mortality weekly report describing cases of rare lung infection, PCP. And I'm not even going to try to say it because it's Punicystis carnipulmonia, so I don't know. So I'm just going to tell you, it's PCP. 5 young, previously healthy gay men in Los Angeles had unusual infection, indicating that their immune systems were not working. 2 had already died by the time the report was published. This edition of the MMWR marks the first official reporting of what became known as the AIDS epidemic. This epidemic is one that I compare to the opiates epidemic. AIDS was a very wise friend of mine who sat years ago on the front steps in my home, and we would discuss such issues. A very wise friend of mine said, God damn it, if they would just stop treating it like a social problem instead of a medical problem. Because that's what they did. Politicians refused to support medical research. They denied funding or even discussed the issue. Ronald Reagan would not discuss the issue for 5 years, no matter how much evidence was put in front of him, would not even breathe the word AIDS. God, no, those people. know those people? In 1983, a national conference was held by the United States Centers for Disease Control to determine blood bank for testing HIV, but participants failed to reach consensus on appropriate action. Wouldn't do it. The epidemic rose from 600 to 3,064 people, of which 1,292 died in 1 year, 1982. Thousands eventually died because of the social stigma rather than being seen as a medical challenge. You know that they did it to themselves syndrome? Sound familiar? I myself was at a training. I'm in human resources, and I've been a social worker of some type, you might call me, I guess, for years and years. And I was forced to go, not forced, that's definitely the wrong word, but it was 1988. By the time they were having people like myself in the field go to trainings to start to learn about AIDS. And when I was there, they were talking about women who had blood transfusions. And I had to go for a blood test. I was tested because they recognized that I had had several blood transfusions when I gave the birth of my oldest son. And it was a very scary time for me. And because they refused to test the blood back in 1982. They were talking about it, but an entire political movement grew up around the silence. This is a quote. An entire political movement grew up around the silence of the Reagan administration. The AIDS activist movement took its call to action, silence equals death, because literally the silence of the Reagan administration was resulting in the deaths of thousands and thousands of gay men in our communities across the country, unquote, by Sue Hyde from the National Gay and Lesbian Activists. Another activist, which you might remember, which was a little more popular to all of us, was Ryan White. He was an American teenager from Kokomo, Indiana, who became a national poster child for HIV/AIDS in the United States after being expelled from middle school because of his infection. A stigma that we here know about. Ryan White was diagnosed with AIDS on December 17, 1984. He was one of the first children, one of the first hemophiliacs to come down with AIDS. And it was definitely a time when there was no education and hardly any information on AIDS at the time. Ryan White and his mother courageously fought AIDS-related discrimination and helped educate the nation about his disease. Because the AIDS epidemic was treated for so long as a social problem rather than a medical problem, hundreds of thousands of people died. Doesn't that sound so familiar? Some will say, and I agree, that there is societal issues to this. Yes, there is. Our children were no angels. They were addicts. They needed to get their drugs. We know. They were part of the criminal system. They were part of rehab systems. But you know, when my boys were young and they first reached out, maybe if they had treated them as medical instead of criminals, things might have been so different. We are in the midst of an opiates epidemic, and thousands are dying again, and society needs to see this too. It is a medical problem. We need better treatments, funding, research, and compassion. Don't underestimate the opiates addiction is also killing and taking our elderly, something we don't talk about much here, but it's true. The medical system continues to pass out medication to someone who can't even remember what day it is, but expects them to monitor medications that are stronger and more addictive than ever. The United States is 4% of the world's population, but we obtain and use 80% of the opiates in the world. We use 99% of the dihydro. Last year, our Federal Drug Administrator voted 9 out of 13, not to allow dihydro on the market. But guess what? It's on the markets anyway. Something is desperately wrong. Pharmaceutical companies have convinced us that drugs that were produced to help end-of-life patients and persons in severe pain are now needed for a toothache, a pulled hamstring, or maybe just a boo-boo. Well, what's the matter? A boo-boo. Purdue Pharmaceutical Company spent $200 million marketing its golden goose, as they call it, Oxycontin, in 2001. $200 million they spent in marketing. Imagine how much profit they were expecting and did make. Tonight, two weeks ago tonight, at just about this time, I lost my second child. I lost another son to this disease. My oldest son, Patrick, too, he died. He too was intelligent, handsome, funny, and he was my first baby boy of 3. And now he is gone too, of this deadly disease. It was a long and hard journey for him ever since high school. And like his brother, he was more the experimenter and got caught in a web at a time when opiates were being doled out like M&Ms in the early 2000s. He got caught up in the golden goose era. He was in recovery for the past year and doing well. But the disease of addiction slipped into his brain, and he used again for the first time 2 weeks ago today, and died, they said, instantly. In the beginning of my speech, I told you that a month ago, they asked me to speak at tonight's vigil. They asked if I was ready, and I said yes. So I tell you tonight, I am not ready to be here and speak as I begin the journey of grief once again of another child. But I am here because we need to be heard, and we need to get others to walk with us. We need to get all the people that aren't touched by this to help us. Numbers. That's why we are all here tonight, honoring our loved ones who have passed. To be like Sue Hyde, Felix Turner, and Ned Weeks, and the Ryan Whites of the world, and all the other advocates that fought so hard during the AIDS epidemic. Like the AIDS epidemic, we are also fighting a level of stigma and discrimination. We need to get the rest of society to stand here with us, the ones that aren't affected yet. Because, like cancer, you never know when your family members will have the disease, and they'll want to know why their family members can't get adequate treatment immediately. Think of the American Revolution, the women's rights movement, civil rights, gay rights. Change can begin with one person, one step. But it takes more than just the village. It takes many villages to stand together to make a difference. And though the struggles continue for all the above mentioned, because none of those things have been solved really yet, we continue on. Let us march on and demand to be heard. I will quote, this is how I feel. I don't know if I can do it. A quote by Dale Carnegie. When we have accepted the worst, we have nothing more to lose. And that automatically means we have everything to gain. With my remaining son, Kevin, and his wife, Jenna Avatabli, Patrick's fiancee, Jennifer Rose, and their son, Tyler Abatabli, and all of our family, my sister, we thank you for being with us tonight. Thank you.